According to Healthline magazine, it is estimated that 900,000 people were hospitalized for the flu last year, and more than 80,000 had died from it. Uh, Today I'm going to talk to you about the flu and proper hand washing procedures as far as to prevent the spreading of germs. Influenza, or more commonly known as the flu, can affect anybody of any age. Usually it affects people under 5 and over 65 the most, just because they have weakened immune systems. And then also it can affect pregnant women due to their um, immune systems also. That's why proper hand washing is vital when you're not feeling well and you feel like you're getting sick. And really, in general, it's just better to have proper hand washing techniques, which I'll talk about later. Um, as far as for preventing it, there's vaccines that they have. The flu vaccine. Um, it's available in injection form, and also in a nasal spray if you're scared of needles or you're allergic to eggs, because they use eggs in the injection form. It's not completely effective, though. In studies, it has only been known to reduce the risk of the flu by 40 to 60%. Flu season, it runs in the fall and the winter. Usually it's more common, but it's between December and February, just due to the cold temperatures, which is what helps um, the flu virus live, is the cold air and the low humidity. So it kind of helps it thrive in that cold environment. Um, I have here a graph of the peak times of the flu season. So here we have December, January, and February, and March. Those all kind of colder months is where it's most known. And then February, obviously, is pretty high. We got about 16 times in this study that they did that February was the most common that it was known to have happened. One of the best ways to prevent the spread of the flu is practicing proper hand hygiene. Just like we were taught in school, you get some warm water, you rub them together with soap, sing happy birthday to yourself, um, and it's just a good way to prevent the spread of germs. I have a little graph here. The flu risk is reduced 60% by vaccines, and then you also have your keeping your hands clean, covering your nose and mouth when you cough, don't touch your face, just make sure you're eating healthy, you're staying active, and then you're staying home if you don't feel well. The most common places to get the flu are public places like the hospital and shopping areas, due to the weak immune systems of the patients in the hospital, and then the customers who feel ill and they rub their nose, they cough, they sneeze, they touch the shopping cart and they push it, and then you come in next and you're handling the same shopping cart that wasn't washed down. So that's why, like, stores like Walmart and Kroger and all that, they have some hand washing, sanitizing wipes right at the door. So it's good to just wash them down, um, and then it kind of cleans it off and gets rid of all those germs. So when you use it, you're not kind of spreading it on to yourself, your family members, other people, and so on. Some side effects are coughing, sneezing, fever, headaches. If you feel any of that, you might be just coming down with the flu. Try to drink plenty of water, plenty of fluids. Most of the time, the flu only lasts about 24 hours, but sometimes it can last a week or two. Just depends on how active you are. If you've been keeping on like your medicine, staying hydrated. That's probably one of the biggest things too, is staying hydrated. Um, so in conclusion, just make sure that you're staying healthy, eating properly, staying active, and if you do get if it is flu season, make sure you get your flu shot. It does help to prevent the spread and prevent yourself from getting the flu, because it's not really a good time when you do. You kind of just feel kind of junky and kind of out of it. So just try to stay healthy, and then it prevents yourself from getting a flu. And then also just make sure that you're washing your hands and covering your mouth when you sneeze and you cough, because then you don't spread it to everybody else, and then um, then you're spreading it, and it doesn't make anybody else feel better. So thank you, and thank you for listening.